So a fair amount of our patients come in that have had a negative experience at another dental office. And one of the ways that we immediately try to get a new patient comfortable is just sitting and talking with them and getting an understanding of what things happened and how we can avoid those things in the future. And I think a lot of that is just slowing down, listening to what a patient needs, and then not trying to rush through and get a sale of a dental case to move forward. So we're not pushy. We like to educate our patients. I know it's kind of a cliche these days, but I think truly we spend more time than anyone I could imagine in consultation with patients. We as the doctors sit eye to eye and knee to knee with the patients and have discussions with them personally about their treatment options. And then we dedicate case managers. We call them treatment coordinators, but we dedicate case managers to follow each one of these cases and make sure the patient has a contact point that they're familiar with and it's not a different person every time they call the office. And I think for those reasons, we're able to help patients move through the correct treatment choices and get to a great outcome. I think a lot of things have changed in dentistry. I think, we're able to control discomfort through medications. We're able to control anxiety through medications. And I think just, a totally different approach, the human approach to taking care of people eliminates a lot of that anxiety and fear. And that's why we don't just, when we have a new patient come in, we make sure that they are completely comfortable with who they've already talked to, our onboarding process, our intake process. And we just don't bring a patient back in the room and start putting instruments in their mouth. We want to talk to them and get them comfortable and let them know that nothing that we're going to do here is going to hurt them. And I think that's the critical part, and listening to what their fears are and trying to address them.